This is Mikael Nordfors. This is part 8 in my course in Tendon Attachment Therapy, and this one is about the neck muscles. While watching this video, please stop the video between each slide and try to find the mentioned tendon attachments on yourself or a friend. This will literally give you more of a hands-on experience. The first muscle is called trapezius. The action is to rotate, retract, elevate, or depress the scapula. The origin is in the spinous processes of vertebra C1 to T12. You see, all this way here. Very similar to pars spinalis of erector spinae. The insertion is on the external occipital protuberance. This is a few centimeters above the lower neckline here, and to the side on the superior medial knuckle line. It also has on the posterior border of the lateral third of the clavicle, on the acromion process here, and on the spinal scapula. Here you can see it in 3 dimensions. This is on the clavicle, spinal scapula, and on the acromion. And you can see how it is a bit high up on the neck here. Next muscle is called Sternocleidomastoid Ears. The sternum is here, cleido is the clavicle, and mastoideus is the process behind the little bone behind the ear here. Here you see it more in detail. The action is to turn the head to the other side, and if you use both the muscles you can bend the head forwards. The origin is the manubrium, sternum, cleido here on the collarbone, and processus mastoideus behind the ear. Important points to press just here, there, and there. Then we have the splenius capitis muscle. The origin is in the knuckle ligament here, and the spinous process of C7 to T3. And the insertion is on the mastoid process of the temporal and occipital bone. As you continue, here is trapezius, and then to the side is the splenius. Splenius cervicis has the origin on the transverse processes of C1 to C3, and the insertion of T3 to T6. These muscles, of course, tilts the head backwards. Then we have semispinalis capitis. The origin is on the transverse process of the lower and cervical higher thoracic columna here. The transverse processes, a little bit more to the side. And the insertion is the area between the superior and inferior knuckle line here. The small neck muscles also, obliquus capitis superior, goes here to the side of the atlas. From the side of the atlas down to the tip of the axis, the spinous process of the axis, is the obliquus inferior. And then up here again is the rectus capitis posterior major, and then from the back of the atlas up to the line here is rectus capitis posterior minor. You don't need to learn the names, but the points are here, 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 and here. Then is the occipitofrontalis muscle. It raises eyebrows and wrinkles the forehead. The origin is in the lateral 2/3 of the superior knuckle line, just laterally from the trapezius to the ear here, and then on the mastoid process of the temporal bone. The fascia of the fascial muscles here, and in the skin above the eyes and nose insertion here. The insertion is in the galea aponeurotica here. It's a tendon going all over the scalp, and it connects the 2 parts. Then we have levator scapulae. The insertion origin is on the posterior tubercles of the transverse processes C1 to C4. And the insertion, this is a very important point, on the superior part of medial border of scapula. This is very often an important point when you have neck-shoulder problems. It elevates the scapula and tilts the shoulder joint downwards. So when you go up here, it goes down there by rotating the shoulder blade. Here you see a 3-dimension picture of levator scapulae. Then we have the scalenus muscles. And there are 3, anterior, medius, and posterior. The anterior and medius are the ones we use. The origin is the cervical vertebra, transverse processes, C2 to C7. and the insertion is on the first and second ribs. This is especially an important insertion, and this too. So this is under the clavicle, the collarbone, and this is just behind the clavicle, the collarbone. It elevates the first and second ribs and acts as an accessory muscle of respiration. It is involved in the so-called thoracic outlet syndrome. So when these muscles are tense, they compress the nerves and the blood vessels, so you can get circulation problems and pain radiating into the arm, very much like the piriformis syndrome in the hip or the gluteal area. When you press this point just below the clavicle, down deep, you often produce these symptoms. So the patient complains that he feels radiating pain going into the arm. And here we see the back of the occipital bone, the neck bone, trapezius insertion, protuberance here, occipitalis, and the sternocleidomastoid ears, splenius capitis, the small neck muscles. Here we see the collarbone from the front, sternocleido, trapezius. Here we see the cross-section of the neck at C6 level. This is the sternocleidomastoid ears. Here we have the scalenus anterior, scalenus medius. And here we have the splenius colli, levatoroscapula, trapezius, splenius capitis, semispinalis capitis, and semispinalis colli. And that was all for today.